Good afternoon, everyone. My name is Geraldine Mitchell, but I go by Gigi. I am the DEI, or Diversity, Equity, Inclusion, Community Engagement Coordinator at the Alzheimer's Association, the Rhode Island chapter. And today I'm going to be talking about a topic that I'm very passionate about, which is how caregiving looks through the lens of Black culture and Hispanic culture. Why am I passionate about this? Well, I come from a household that is half Black American and half Puerto Rican, and there's multicultural factors that the healthcare system and anybody that is providing care to these two populations need to consider in order for that care and support to be more effective and more tailored to the culture, right, and the audience. So some of the learning objectives, we're going to briefly go and provide a general description of dementia and Alzheimer's disease. We're just going to explain why Alzheimer's disease is a public health crisis. We also want to identify health and healthcare disparities and the contributing factors of these two issues in public health. How is it caregiving in the Black culture? How is it caregiving in the Hispanic culture? And also the importance of bridging racial and ethnic barriers to care. Just in case there's anyone here in the room that does not understand quite well what is the difference between dementia and Alzheimer's disease. Many people think that dementia is the disease, but it's the description of the symptoms, right? When we talk about loss of memory, language, problem solving, other thinking abilities, that is what we say this person has dementia. Now, physicians or doctors have to identify what is causing that dementia in that person. And Alzheimer's, that's when it comes in the game, because Alzheimer's is the most common cause of dementia. It accounts for between 60% and 80% of the cases. And Alzheimer's is the actual disease, which is degenerative, incurable, unfortunately. It affects the brain, and it's, like I said, the most common cause of dementia. Now, why is Alzheimer's disease a public health crisis in the United States? Now, every 65 seconds, someone is diagnosed or develops Alzheimer's disease in the United States. To me, those numbers are alarming. We're talking about every minute and 5 seconds, right? Currently, around the world, there's an estimated 50 million people living with dementia. And out of those 50 million people, nearly 7 million are Americans in the United States living with Alzheimer's disease. We believe that number is higher because there's a lot of individuals that have not received an official diagnosis or are still not able to identify that the symptoms that they're presenting could be an Alzheimer's disease diagnosis. It actually was officially listed as the sixth leading cause of death in the United States. And 1 in 3 seniors dies with Alzheimer's or with another dementia. And the last one really sticks out to me a lot because we hear a lot of breast cancer and prostate cancer. But the data is showing that if we combine the death rate of breast cancer and prostate cancer together, Alzheimer's death rate will still lead and be both together. Okay? This chart right here really describes the percentage of Americans 65 and older that are living with dementia right now in the United States. As you can see, Black Americans are accounting for 19% of individuals 65 and older living with the disease in the U.S., following Hispanics with 14%, and then white Americans with 10%. Now, as you can see, Black and Hispanics are the ones living and accounting for most of the cases. However, you're going to see throughout this presentation that are the ones less aware that they are at risk and the ones less aware of resources and being able to manage it. And there's some multicultural factors that can be a barrier to that, and we're going to see that later on. This chart right here is to really highlight the differences between a caregiver of people with Alzheimer's disease or other dementia versus caregiving for other older people. So as you can see in the purple bar, we're talking about getting in and out of bed and chairs. 45% are for people that are living with Alzheimer's disease, the demand is greater there. Following getting dressed, bathing or showering, feeding, getting to and from the toilet, dealing with incontinence. As you can see, those that are living with Alzheimer's, the demand is greater and support from caregivers is much needed. Now, is it a public health in the Black and Hispanic community? We have seen that there are more Black and Hispanics living with the disease in the States. But is it a problem in public health? Yes. Hispanic and Black African Americans in the U.S. will see the largest increases in Alzheimer's disease and related dementias between 2015 and 2060. We're talking that by 2060, the number of Alzheimer's cases is predicted to rise to an estimated 14 million people. Remember I mentioned 2 slides before that right now in the United States, we have nearly 7 million individuals living with the disease. This is saying that by 2060, it is projected to go up to 14 million people. And if we break those 14 million people into Hispanic Americans and Black African Americans, the cases among Hispanics are going to increase 7 times over today's estimates. And among Black African Americans will increase 4 times. So right now, you're seeing a trend where the data is showing that African Americans are at greater risk and following Hispanics, but you can see by 2060, you're going to have more Hispanics living with the disease versus Black Americans. Not saying Black Americans will be at a lower risk, is that we're seeing that increase when it comes to population. And you might be thinking, why is that a thing? Why we are projecting that? Well, there's health conditions such as heart disease, diabetes, that may account for these differences, since they're more common in Hispanic and Black communities. Lower levels of education, higher rates of poverty, greater exposure to adversity and discrimination are also increasing the risk of Alzheimer's disease. Not saying that diabetes or adversity, rates of poverty are not present in other cultures, but are more predominant in Hispanic and Black cultures. Here I just want to highlight the difference between health disparity and healthcare disparity. I feel like they're used interchangeably, but health disparity basically exists when there's a higher burden of illness. There's injury, disability, or mortality experienced by one group relative to another. And then healthcare is more about access, right? It describes the differences between groups and health insurance, coverage, access to, and use of care, and the quality of this care. And what are some of the factors contributing to health and healthcare disparities? It mainly falls into the healthcare system. We're talking about implicit biases on the part of healthcare providers. So when we have implicit bias, all of us have it. Problem is when we don't check in with those implicit biases, because they can cloud decision making. They can lead to discriminatory behaviors, right? You think about a way of someone, you have stereotypes about someone, and that can interfere with how you make decisions and the type of support you provide to that person. There's also cultural and language barriers in the healthcare system that impede patient-provider relationships. Poor understanding of how different racial and ethnic groups view, access, and experience healthcare is a different experience for each type of culture and population. And this is important to address, and we have to prioritize in public health efforts to address this problem in healthcare systems, because it is projected that people of color will account for over half of the U.S. population in 2050. So if we don't have a healthcare system that is equipped, that understands culture, that understands all these multicultural factors, and don't check in with their biases, don't get the education needed on how to provide services that are tailored for the specific population, we can foresee a big problem here in the future. Black Americans are unfortunately 2 times as likely as white Americans who have Alzheimer's disease. And I get questions a lot in the community as to why us Black people, we are at a greater risk. And again, there's not a specific reason or fact, but some of the research and data has shown and have led that it could be to socioeconomic factors. And like I mentioned in the slide before, living in poverty and lack of education can lead to poor cognitive or health or cognitive decline. And nearly 2/3 believe medical research is biased against people of color. And that's a problem, because if we say in the public health field that Black Americans are at greater risk, we want to understand why. So when Black Americans of the population that are at risk are saying and feel that there is biases in clinical research, they're not going to participate. And we're not going to have that DNA. We're not going to have those social culture factors to evaluate to understand why is it that this population is at a greater risk. This also can lead to poor access or utilization of external support services and healthcare navigation. When we go to physicians or to a specialist, we meet with social workers or community health workers or the nurses, the home care team, they go over a series of options for the family. Hey, what about respite hours? What about nursing homes? But when we're talking about a population that does not trust the system because of the things that I mentioned in the previous slide, they're less likely to access and just want to utilize these services. So 69% of Black dementia caregivers were found to be less likely than white caregivers to use respite services. And now we're talking about a population that living on below the federal poverty level, that most of them are working hourly wage jobs. They don't have the time, they don't have the privilege or the opportunity to say, well, I can just work half the day and go home and take care of my loved one and still be paid the full day, right? They will lose hours, meaning less money. That will increase social determinants of health or social drivers of health, more food insecurity, more housing insecurity, perhaps transportation. I don't have the money to pay the car now because I have to leave my job, I have to quit my job in order to take care of my loved one. So it's a chain and it's a domino effect of things when we're talking about populations that are really needing external services, but they're not getting the support because of the way the system is created and the perception also because of experience lived navigating the healthcare system. 2 in 5 caregivers, which we're talking about 41%, who provide unpaid care to Black persons say that race makes it hard for them to get excellent health care. And when we say unpaid care to a Black person, we're talking about even family members or even someone as a nurse or a community health worker that they have witnessed the hurdles that a Black person has to go through in order to get access or excellent health care. This video right here is a article from it was published by Kat Stafford from the Associated Press. And this was a series that was done back in 2023. And it was basically the Associated Press wanted to highlight 5 different stories. It doesn't have to be specific to Alzheimer's, but they happen to highlight an Alzheimer's story. And how healthcare disparities affect Black Americans. So I'm going to show this so you can see the story and you can hear from the caregiver themselves how does it look like when it comes to caregiving for Alzheimer's.
I have watched my mother completely change over the last 7 years. Yay. Alzheimer's truly impacts you mentally, spiritually, physically.
No ma'am. No ma'am. I'm tired already.
I am an only child and the daughter of Constance Guthrie, who is a single mother, and we have been 2 peas in a pod for the longest. Constance was born in Virginia, and she has always been someone who was going to have big ideas and follow them. She opened her own salon called Hair by Connie, and she owned a brick and mortar salon in Alexandria for 18 years. She has always been over the top. She has always been just like flamboyant in terms of her style. She was loud, like you knew CG was in the room. She moved from talking, walking, singing, everything, to now being fully bedbound.
You gotta keep the circulation going. Ain't that right?
I've been grieving my mom for 7 years.
Your little chicken legs.
Slowly losing her is actually the hardest part of this disease. Oh, we had a whole system. I would do these notes, and then she would call me like overwhelmed and say, go to the kitchen. Now read the green note. What does the green note say? Your email says you're back at that? Exactly. What else does it say? It says I'm safe. Exactly. You're okay. You know, like, the things that I did to try to keep her calm, I still just think, how did you do that? You realize how heavy this has all been, and how lonely the last 6 months have been, because no one was here when my mom was falling, and I had to call the fire department to get her up, and this was like multiple times a week.
Good job. Can you give me 2 more? 1. Good job. I'll leave you alone. Good job, Constance Guthrie. Good job, good job. Good job, good job.
This disease disproportionately impacts African American community, yet we're not talking about that.
Yes.
There's a lack of resources, a lack of knowledge, a lack of access, and I know for a fact that falls on racial lines.
Can you roll? Thank you. I learned that after getting this one, they make electric ones.
If I didn't put her on hospice, we'd be back and forth into the hospital, and that is not the place where she would have gotten equitable, thoughtful, comfortable treatment, particularly because of her race. I just think that part of my journey would have looked significantly different if I were a middle-aged white person or a white male.
You're okay.
I would have been listened to the first time. I would have been respected in terms of following through on things.
This little light of mine, oh, I'm gonna let it shine, oh, the light, take.
There's times I'm just like sitting next to her and holding her hand, and she starts to laugh.
Precious Lord.
Or she'll say something that just like catches me off guard. Don't count her out, she's still there.
Woo. Crying girlfriend. Woo. Did you like that one? Did that sound nice? Very good. Did you like our sing-along time today? I think so. You okay?
There you go. Sorry. Lots of emotions. Okay. So Hispanic Americans and Alzheimer's disease. Hispanic Americans are 1.5 times as likely as white Americans to have Alzheimer's disease and other dementias. The particular problem with Hispanics is that almost 60% believe that significant loss of memory or cognitive abilities is a normal part of aging. What happens is that they're less likely to report symptoms, they're less likely to get an earlier diagnosis. Also as Black Americans, because of, they're thinking, well, memory loss, I'm forgetting things, this is normal, I should not think anything of it. And also 1 in 3 report that they have experienced discrimination when seeking health care. There's something very particular about Hispanics, me coming from, like I said, a Puerto Rican household. I've seen this and I live this to this day, and it's a concept called familismo. I don't think there's a translation to English, but what it means is the loyalty that you have for your loved ones. And when I say loved one, it's not a loyalty to mom, dad, or a sister or a brother. It's all the entire family. Talking about great-grandparents, grandparents, nieces, nephews. All the family comes together, and all the family members have to have discussions as to how they can support and what will be their role in that family, right? I think that the next video I'm going to show is a TED Talk. This is Dr. Lidia Arevalo Flechas. She was born in Bogota, Colombia, and she is a bilingual and bicultural investigator with a special interest in the cultural and linguistic competency of intervention programs for Hispanics and Latinos. If you don't know the difference between Hispanic and Latinos, we use those words interchangeably. Hispanics are when there's Spanish is spoken in the household, right? It could be because mom and dad are Hispanics, and then Spanish is being spoken in the household. But Latinos mean people that were born and raised in Latin America, so any country from Latin America. So you might see what she's going to highlight in Hispanic households, but you will see it even more for Latino families. Okay? Dr. Arevalo, has earned a reputation for cutting-edge research on the factors influencing Latino Hispanic caregivers' perception of the experience of caring for a relative with Alzheimer's disease, nationally and internationally. I can go and explain this myself, but I think the way she explains it and goes by it is perfectly.
Hello everybody, it is a pleasure being here today. My talk today is not about my research, and you must be saying thank God. My talk about today is the people who have made my research possible. I made a promise a while back, and today is the day I fulfill that promise. For the past few years, I have had the privilege and the honor to meet and interview over 300 Latinos or Hispanics, all of them who at the time were taking care of somebody in their family, a loved one who was living with Alzheimer's disease or a related dementia. You may know them as caregivers, yet they do not see themselves as such. They will tell you that above all, they are husbands and wives, brothers and sisters, and sons and daughters to their loved one. I listen to their stories, and I'm here to compensate them today. I heard and learned about the tremendous struggles that they face on a daily basis. They lead very stressful lives. It is very difficult. But what truly grabbed my attention was the tremendous difference that I began to hear between how these Latinos who spoke to me in English or Spanish, and some of them both in English and Spanish, talked about their experience of caregiving for the loved one. There was something very different about how they described the experience as compared to those English-speaking caregivers who were from other cultures. When I speak about caregivers, I am not so sure that I'm using the correct word. Why? Because we don't even have agreement in the English language about the word caregiver. In this country, we may know them as caregivers, but in some other countries, they are called carers. Then somebody comes along and makes things a lot more difficult for me because they decide to translate caregiver to cuidador. But when you look it up in the dictionary, you're going to find out that cuidador is an adjective. It denotes someone who minds something, somebody who is careful. Nowhere have I been able to find out a source that tells me that cuidador is a person. The person taking care of horses is a trainer. The person that is taking care of animals at the zoo is a zookeeper, and you will find many bad translations. But there is no source that tells me that cuidador is a person who has assumed full responsibility for the well-being of a loved one or another person. I challenge you, send me the source. My email is on the program. I would love to have that source. This really is a problem, an issue of a concept lost in translation. Culture is language, and language is culture, and I believe that we have that agreement in general in the sciences. Language is also the vehicle that allows us to pass on from generation to generation traditions and values, and it's also the vehicle that gives meaning to our reality, to our world. It is not uncommon to have Latino households that are intergenerational, and children grow up witnessing the very dutiful and respectful way in which family members take care of others. It is not a bad transition. In fact, it's a very natural transition to grow up in a Latino household taking care of family. But that's not the same in other cultures in which the person may begin to feel captive in that role. And in fact, they may begin to experience something that in the Alzheimer's caregivers world, we have come to label as caregiver burden. You thought that the word cuidador created problems for me. That's a piece of cake. The real problem is burden, because somebody has translated burden to carga. And whenever I use the word carga when I interview these Latinos, they cried, they felt offended, they felt it was demeaning whenever that word, the word carga, was attached to the description of their experience of caring for the loved one. Somebody sitting in the audience today told me about her mother who was dying with Alzheimer's. Carga, she is my blood. I am what I am because of her. How could you possibly ask me that question? I learned a great deal. And those sentiments, I continue to hear them over and over from these Latino families. I told you that I have to fulfill a promise today. So in the less than 5 minutes that I have left, I am hoping to leave you with the 10 most important things that these families will tell you if they had the privilege to share this stage with me today. Number 10, please get to know me and my family very well before you start suggesting placement of my loved one in an institution. We're almost never ready to have the nursing home talk. Why? Because we believe in interdependence, not in independence, not in being individualistic and competitive. Those things are core values in other cultures. In our culture, we derive our strength from our families. Dementia really rocks the core of our families. It's a tremendous strain, but we consider it a very private matter. Keeping our loved one at home for as long as possible is something that gives us a tremendous sense of pride and that allows us to fulfill a filial responsibility. That is why we have a tremendous time, just a real bad time, asking for help and using services like respite and home health services. Very hard for us to do that. Number 7, no one taught us that we had to assume this responsibility. It was a role model for us our entire lives. No one had to teach me that. Number 6, when you ask me, or when you say, hi, how are you? It means the world to me when you stop and listen to how I am doing. We are very personalistic. We really are. Very seldom you will hear that I say, fine, thank you, and you, and that I'll be on my way. That's just not us. Number 5, it is not true that there is no conflict in Latino families. It's a lot of it. It's a very well kept secret. But it's many of us, and we all want to have a say when major decisions need to be made about our loved ones. Number 4, it is an honor to be taking care of my loved one. Number 3, yes, it is difficult. I think it's a cross that I carry, but I carry it very willingly. Number 2, it is a duty and it's not a burden that has to. Please learn from that from us. It's not a carga, it's not a burden. It's a heavy job that we do with love. And number 1, the most important thing for me as a person, as a Latino family member, is to know that I will be able at some time to fulfill my duty as a family member. When the time comes, I need to make sure that my loved ones know that I will be there for them. I really want to thank you, TEDx, for putting the T back in there, because it was very important. Molly was joking here. I was the one freaking out. They're saying this is impossible, this cannot be happening to me. It's not just the people in the audience today whose the photographs of their loved ones have been on the slides. I'm fulfilling the promise I made a few years ago to caregivers in Colombia, in Peru, in Mexico, in Puerto Rico. So this one was for you guys. Thank you for your attention.
Okay, so just to briefly summarize what Dr. Arevalo said, basically, when Hispanic families go to their physicians or just to seek for help, the requests, they may seem overwhelming because it's a disease. Caregiving for someone with a disease is overwhelming. But the request most likely is not that I want someone to replace me, I want this taken out away from me. Is I would like services that will help me be better at fulfilling this duty. Like she said, it's not a burden. Hispanics, when that is taken away from them, they feel they have failed their families. There's a lot of family dynamics that happens afterwards. So nursing homes or assisted living does not happen. Those conversations do not happen. You might see them here in the United States because you have, like I said, Hispanics that might have adapted to the culture here in the United States. But when you hear Latino families, they are not gonna take nursing home conversations well, because we want to remain and keep our loved one home. That is the major ultimate goal, and that's the way to honor that person. And that's regardless if it's Alzheimer's, but just to keep that person home. So, I want to go briefly over this survey that the Alzheimer's Association did. So it was a brief survey between October 2020 and November 2020. And what they were trying to do was to study a population base that it had to do with current or recent unpaid caregivers for an adult relative or friend age 50 or older experiencing problems with thinking, understanding, or remembering things. And there was a total of 1,392 participants. And if we break that down based on race and ethnicity, around 313 were white Americans, 309 were Hispanics, 305 Black and African Americans, 301 Asians, 154 were Native Americans, and 10 were considered themselves part of other ethnic or racial groups. So this table right here is what I want to highlight from that survey, and it basically goes about the types of discrimination based on race, color, and ethnicity among Alzheimer's and dementia caregivers. So I want to highlight here Hispanics and Black Americans because those the two cultures that I'm talking about today in this presentation. But if we look at the questions that were asked to these participants, first one was if, as a caregiver, they felt listened to. If the provider acted like they were not smart, if the provider or if they were treated with less courtesy than others, if they were treated with less respect than others, received poorer services than others, and if the provider acted afraid of them. And if we look into the percentages that goes and fluctuates between Hispanics and Black Americans, they have the highest percentages saying that they felt this way and acknowledging these questions, which again, it sheds some light as to why we are dealing with such a big healthcare system that is working against the population at risk and not in favor. And these are just examples from true caregivers that are taking care of individuals or people with Alzheimer's disease. Okay, so bridging racial and ethnic barriers in Alzheimer's care. This is very important because, again, We have to fill those gaps that the healthcare system is not covering, and just change things a bit to make things more tailored and more applicable to each racial and ethnic group. This can apply to both Hispanics and Black Americans and also other racial groups, but today I want to highlight this specifically for Black Americans. Faith is huge for the Black community. Faith is, I would say, everything. Faith-based organizations in Black churches have provided one of the most safe environments for Black Americans to seek support, to come together and to support each other. So the Alzheimer's Association has a national partnership with the AME Church, and specifically in Rhode Island, that partnership has been brought to Rhode Island as a local partnership. Right now, the Alzheimer's Association has a partnership with the Bethel AME Church in Providence. Theresa and Howard Jenkins are pastors and first lady of that church, and every last Sunday of the month they open their doors so that the Alzheimer's Association can join the service and talk about Alzheimer's and the impact in Black American community, and just have conversations on how to improve services for the Black residents here in Rhode Island. And that's something that's called Purple Sunday. But other things that this partnership will enable is increasing concern and awareness of Alzheimer's disease within AME's community, providing care and support resources, volunteer engagement, education to AME members. And it's important that Black Americans get engaged and educated about Alzheimer's, and they can promote this education among the community. Because again, data has shown that Black Americans are one of the best educated about this topic. So if you are not well educated about a problem that is directly impacting you, how you will advocate for yourself. And that is important, that's what we're trying to do. Expanding research and scientific support opportunities for AME's leadership and congregants. Taking advocacy actions on state and federal issues that affect AME members. Another alternate program is called Alter Program. This program provides support tailored for faith communities. So this program right here, to me, I consider one of the most innovative. It could be a catalyst of a lot of change in the Black community, because what this program does is that it partners with faith-based communities, and it provides the training and the services so that Black caregivers can still attend church service. Because that is huge, when Black caregivers are limited and can no longer attend their church because they have to stay home with their loved ones. So Alta program is actually filling that gap. How can we empower and provide the resources that Black churches need so that when they have their service, caregivers can still join and they can come with their loved one if they don't have someone staying home with their loved one. So that's having a respite room for their loved one while they are in the service, or just having conversations, educating the members at church. So if the loved one has an episode or is exhibiting behaviors, everybody knows how to intervene. So this Alta program is amazing and it's doing wonderful things across all states in the United States. And once this church has received the training, everything, the church becomes an Alta champion. And that's when they start making sure that their church is mission friendly for the caregivers. So another example, in this case we're going to talk about Hispanic and Latino Americans, is like Dr. Arevalo said, making sure that the services that are provided or designed or shared with the Hispanic and Latino community are promoting interdependent and family-centered care. Like I said before, we don't want this taken away from us. We want tools that can make us better at doing exactly this. And how this support or promoting interdependent family-centered care can look like. Well, educating the family members to better support activities of daily living or ADLs, like showering, feeding, hygiene. You will go to Hispanic and Latino families, and many of them, they don't want CNA. They are not trusting, I don't want a stranger in my house. Back then, I would say like 7 years ago, I worked for an organization here in Rhode Island that will do monthly visits to see how that family were doing with CNA or home care hours, if they needed more hours or if they needed less hours. And I remember the Hispanic families were the ones asking for a particular program that it was, if the caregiver was living with the loved one or the person that needs care 24 hours, 7 days a week, they will get a stipend from the state because of promoting care. So that was really more requested by Hispanics, again, because they don't want to stop caring for the person. They just want the support to do so. And that's just one example of that. Behavioral health services focus on providing tools to family members to become better supporters. I think behavioral health clinicians can just go ask questions. What does taking care or supporting your father or mom looks like? Instead of using the word caregiver, they don't use that word. We don't use that word because I'm just a daughter, I'm a son, this is my responsibility. And having those conversations and understanding what this family dynamic, or in this case caregiving, looks like for them. And I think that will shed some light to behavioral health clinicians and providers in general. Support groups. Support groups, instead of labeling them for caregivers, say for Hispanic families, because that way they will join because the whole family is caregiving for the loved one. There's not one person assigned to caregive for that person. Yes, there could be someone in the family that could lead and reunite and make sure that everybody is filled in with what's happening, but everybody has a say and an opinion, and when it comes to decision making, it is respected. The Alzheimer's Association has plenty, I would say over 20 partnerships nationally. I just want to highlight this one as an example as things that could be done from a systemic level. Alzheimer's Association has a partnership with the National Hispanic Medical Association, which is a nonprofit that represents the interests of 50,000 licensed Hispanic physicians in the U.S. So what this means is that they are getting firsthand the up-to-date data when it comes to Hispanics and Alzheimer's, education, more tips about how to provide care and support Hispanic caregivers, conferences, just everything that is going on within the Alzheimer's world. This partnership will enable them to get that, and as physicians, they will provide better care and care that is more culturally centered to their patients.